So my name's Karen and today we're going to look at hip health. So a few exercises to help open up the hips. So for general health, back care, and if you were going for cervical screening. So the first one we're going to do is just a little tap and a leg opener. So you can put your hands wherever you want. You're going to just take a tap out and a tap out in front and then a gentle opener to the side. So sit tall on your chair, take a breath out. Out to the side, out to the side. So just getting used to opening these legs up. And out. And out. And you could do 3 or 4 of those, building up to 6, 7, 8. So then for sciatica, and again to try and open up these hips a little bit more, you can do our seated thread the needle. So we're going to bring one foot up onto the knee, hold underneath the foot and hold underneath the knee, and we're just going to try and let this knee relax, and you might feel that you've got a little stretch down the outside of this hip. So again, we're opening up the hips. It's a good one if you do get sciatic pain. And if you feel like there isn't much of a stretch there, you can just lean gently forwards, keeping the back straight. And then when you're ready, come back up. So you might want to hold that for 10 seconds, 15 seconds, come back up, and then do the same on the opposite leg. So then we're going to come down onto the mat and look at a couple of extra exercises for hip opening and for releasing into the pelvis and the spine. So the first ones we're going to do, you could do this lying in bed or down on the mat if you wanted to. So come down onto your mat, onto your back. And we're going to place the hands on the belly and just do a gentle little pelvic tilt. So feet flat on the floor. You're just going to think about pulling up through your pelvis and flattening your back towards the floor, and then breathing in again. So just a gentle tilt. Just noticing how the back feels. And then we're going to do a knee hug in. So as we breathe out, we're going to pull the belly towards the spine and lift the left knee in towards the chest. Now if it only comes to here, that's fine. Just hold it there and then tap it back down. Breathe out. And then the opposite side. So breath out, draw it in, just to where it wants to go. And back down. Now if it will go a little bit further, on the second time, breathe out, draw that leg a little bit closer if you can. And back down. If that one's a struggle, you can use a cushion underneath your bottom. Or we've got our Pilates balls. So you want a deflated ball, not too pumped up. And you're going to just again come to that little tilt and place that ball underneath the pelvis. So say you could do this one with a cushion, get it in a nice comfortable place. And then you can start to again do that knee lifting. So you might want to just lift that knee in. Don't worry if you wobble, it's strengthening the core. And it is just allowing that pelvis to tilt up a little bit. The last one we're going to do is our knee drop. Hands on the belly so you can feel what the hips are doing. We're going to just drop one knee down to the side. Bring it back to the centre. Try and keep these hips even. Without arching the back. Nice breath out, breath in. And then the same on the other side. When you come to your screening appointment for cervical screening, you're going to need to be in this position with the feet together and the knees open. So the more open you can prepare yourself to be in the hips, the more comfortable you'll be during that appointment.